Welcome back to Inside the Locker Room, part of the Clinical Champions series, where we sit down with experienced thought leaders to discuss clinical realities and the small details that can make a meaningful impact in practice. In today's episode, Dr. Cody Kriegel, a biologic dentist practicing in Iowa, joins us for this Part 1 Q&A discussion on photobiomodulation. Dr. Kriegel shares what this light-based therapy is, the science behind how it works, and what led him to incorporating it into his practice. He also answers common questions about the role of photobiomodulation in supporting healing, enhancing patient comfort, and expanding clinical treatment possibilities. Let's get into it.
Yeah, well, you know what? My wife says that around our house with our kids all the time, and I'm like, we're not in the weeds already? Like, I'm like, I can't see the top. So I get it. I can relate, just not. Yeah, well, you know what? Is to learn about a topic, try to collect research on it. Like, is there research on it? If there is, what does that look like? Keep that research, and then like see, okay, how is this being utilized in our field? And I find that dentistry lacks what medicine sometimes is good at, as in dentistry lacks some of these types of modalities. Like dentists, we just don't think about it that way. We think about physically repairing a tooth, like mechanically. But I think we need to first look at the system of a human being. Of course, we have to fix teeth. So I started to kind of develop an ecosystem of how I felt dentistry should look and what it, and that blends into kind of how I treat. But I started to learn about lasers kind of early on in that, but I wasn't aware of anything that was easy other than like when you go and find, a simple red light online or whatever. And that just didn't, if we're trying to run a high-end dental and medical clinic, that just doesn't fit. And I came across Miguel. Miguel is a good friend of mine. And I asked him about the ATP38 because I'd seen him post about it. And then it just kind of went from there. That's called the WebMed. It's from Germany. And we use 3 of the wavelengths. I think there's 5 total. We use 3. And basically when we run an IV the day before surgery, the day of, and the day after, we obviously have access to a vein. And most of my surgeries are with sedation. That's why we're obviously using PRF, because we're already accessing a vein. And when you're using PRF, which is a lot of growth factor, and then you hit all those growth factors that are concentrated with light, you really get stimulation, right? You really get an effect, which is why it's nice to use PRF on the face and then hit it with an ATP. You're getting a lot of turnover. That system we use after an IV is finished, we can take out or we can unplug the IV, we leave the catheter in, and then that system feeds a fiber optic light, really thin one, into the catheter, into the vein. And then we can stimulate like all the cellular components that are going through the system over 10 minutes, 20 minutes. The blood tends to go around the human system and back like every 3 to 4 minutes. It's kind of a wild notion, but so different wavelengths there can stimulate different things. And if we layer hyperbaric in there, now we have even more of a modality, like another set of things that we can kind of belly off of. I like that because, as you saw on the slide, for example, and as you all know, the penetration depths are different. So some of those lights, like red goes deep, but like green and blue don't go as deep. So if I want green and blue to get deeper, like I have to take it deeper. And that's where when you feed it into a vein, you don't get any deeper. That's called the WebMed protocol person. Mm-hmm. Like that's how my life is very regimented, which is why having 4 kids is difficult because they kick it out of regiment all the time. But so I tend to find the 3, 4, 5, 6 of them that we like, stacking some of those or whatever, and then I kind of keep it set. And then every few months, I'll go back in as a reminder to myself and kind of look and say, hey, is there any other ones that we feel like could benefit in, this scenario? But I tend to utilize the same handful for most of what I'm doing in surgery is how I go about it. See, dentists are tough. I can say it because I am one. I'll just talk negative about it for a second. They're brutal because we get kind of programmed to be like A, B, C, D. And I know that I'm a regimented person, but you get so programmed that you just want to know, okay, I just turn it on and I hit this button and then it's supposed to magically like do all this. And it's like, well, hold on. Well, how many sessions? If they have this, is it 2? Is it 4? And I think they need to take a step back sometimes. And like healing is not a definitive thing. It's very complex. And so you can't boil everything down into just A, B, C, D. I think that's the tough part. And dentists are just programmed that way. They want to know the same few things. And it's like, take a step back. And you have to see the big picture before, they're difficult. The brains work differently. You want to know the same few things. Being a little bit of one, what works in their practice. Like, are they able to see a patient repeatedly, over handfuls of weeks? Because that's one downside I feel like with laser therapy a little bit, and particularly hyperbaric, it's a downside, is like one treatment is better than none, but you get better benefits by stacking. And hyperbaric's very forward in that. Like one session is great, but like you can't get much out of it. You need to do a series. And so that's a little bit of how laser works. When it gets into anti-inflammatory and healing, you can kind of kick somebody off in the right direction. So even 1 or 2 or 3 around that is really good. But that gets into maybe like how a practice is set up. And that's a good point. Up being it gets a little bit into, pain is a subjective metric. And it gets hard, and so is healing, like super subjective, right? And I'm like him a little bit. Actually, I'm like him a lot in this situation where I like objective measurements, right? Which is why, like, if we have a new patient come in, every new patient goes through like a battery of things, because I want to know objectively what's going on with this patient without like them telling me, oh, I have this or this or this, right? I want to know objectives first. And so I think this is where it gets hard, because it's hard to measure then, when somebody subjectively feels. Some people might feel good within 1 or 2 sessions, some might be 5. So I think it's difficult, and that's kind of the nature of healing and these types of things. And for us, the way that I phrased our system, because I think on the back end, when we do bigger surgeries, people have very little swelling to no swelling. Like no one leaves like a Rocky Balboa, like from our practice. 1, it's bad for business, and 2, I don't want it. Right. And no one leaves with cotton rolls in there and like a cotton swab, all that stuff. Not an option for us. So people ask, well, what if I don't do, ATP, or what if I don't do this? And my analogy I usually use is a plant. So if everyone knows what it takes to grow a plant, most plants, which is, water, sunlight, those types of things. If you study it objectively, and this is how science tends to work from my perception, if you put a plant in a closet and you just gave it water and it died, then the conclusion of the study is water kills plants, right? If you did the same thing, or if you left it on the windowsill, but you gave it no water, you'd say, well, sunlight kills plants, right? That's kind of the conclusion objectively. But in some of this stuff, it's like, no, you can't, it's one variable, versus many. Right. So in this case, in my clinic, it's like, well, I like hyperbaric and I like this and I like this. I know it's a little bit kind of a lot, but all of them synergistically working together get you there quicker and easier and more efficiently. So no, water doesn't kill the plant. No, sunlight doesn't kill the plant. Together, that's what it needs. And I think that's what healing is like. So it's hard to measure, for pay a lump fee. And I think that's important, because then if they needed 5, but they're not, the 5th one might have been the one that really like helped them the most, because you've stacked 4 in front of it. And then they don't want to come in and pay for the 5th one. You didn't have the effect that you could have had, and they might not have had the experience that they could have had. So I like a flat fee. And if they come in 3 times or 7, you're not out anything. You know what I mean? Right. Like there's not consumables. And so that's how I feel like it should be done. But that's different for everyone. I bundle into like surgeries. That's just like, it's not an option. You just get it no matter what. But that's a good approach, I think, for having it like as an accessory to things, because it's like the same concept as hyperbaric. People don't really buy 1 or 2 sessions. You might buy one to try it, but you buy like 10 sessions, 20 sessions, 40 sessions, depending on what you're going for. And that way, how do I say it? Human psychology likes like 3 options. That's why you get small, medium, large. And most of the time people don't want most of the time they go into the middle. So if you have like a 5 sessions, a 7 or a 10, most people are going to land in the 7. You know, they don't want to go low because they want more out of it, but they don't really want to, they feel bad expending money on themselves. So they don't want to go for all for it. Except for my wife, she'll go for it all, which is great. It's like one of my favorite things about her. But they'll land in the middle. So I like, packages make a lot of sense to me in my mind, as far as like if you're trying to utilize it in that format, then I think packaging it is a good idea. And that way you can then say, I don't know if the 5 sessions would achieve probably what you're after, but I think the 7 would. And I think 10 is great. And if you want to do 10, I think you'll love it. But like, I don't know if it's necessary. Then they will automatically take a 7. You know,